Let's talk about functional neurological symptom disorder, formerly known as conversion disorder, formerly known as hysteria. This is a disorder that has been documented for millennia, dating back to the ancient Greeks, who believed it to be a disorder exclusive to women, and thus named it the wandering of the uterus, which roughly translates to hasteia, which then later became hysteria, which became conversion disorder, which became functional neurological symptom disorder. So, what is it? Imagine you've just lost your parents in a traumatic accident. Say, something like this. And bam, you're blind. And that's conversion disorder. This is a psychiatric disorder, according to DSM-5, and causes patients to suffer from neurological symptoms without a definable cause. So, what's that mean? Well, the leading explanation is that symptoms arise in response to the patient experiencing a stressful situation or a traumatic one. Essentially, this means that there is no single cause, and no one really can pinpoint it down to anything specific. Conversion disorder really came to prominence in the 1800s as a result of three major neurologists at the time focusing their studies on this disorder, and they were Jean-Martin Charcot, Pierre Janet, and everyone's favorite, Sigmund Freud.
Hello, darkness, my old friend.
Before these three studied the topic, patients suffering from this disorder were believed to simply be malingering, that is, exaggerating and making up their own symptoms. In fact, it was Freud
Hello, darkness, my old friend.
who coined the term conversion for this disorder, as he theorized the patient's anxiety was converted into physical symptoms. The symptoms typically impact senses and movement, and can include these symptoms are generally short-lived, just days, and are always temporary, and weirdly enough, they can vanish at any time. The DSM-4 details that there is a link between the severity of symptoms and the extent of medical knowledge in a person. Those with less medical knowledge have more severe and more implausible symptoms, while those with extensive medical knowledge have far more suppressed and timid symptoms. Conversion disorder can develop at any time. It is found in all ages, but primarily between the ages of 6 and 35, with a large decrease outside this range. A parent possessing conversion disorder can lead to a greater risk of their child developing it, as does a previous diagnosis of any mental health condition. A history of physical or sexual abuse can also increase these chances. So can being a woman. Originally, who else but Freud believed this to be a women-exclusive disorder. And now, it's found to be truly about a range of 6-to-1 or 2-to-1 in favor of women. Now, these ratios might seem like they're wildly different, but it's because the actual numbers are less than 300 per 100,000 people, which is about 0.003%. And the treatment for this disorder is limited, largely as a result of the inability to pinpoint a cause. But common sources of treatment are talk therapy, stress management, and physical therapy to the affected body part.